Yes, so you're welcome, all of you, at this presentation uh, where we are going to talk about the global burden of disease. If you have watched the first video or the first lecture that we had on introduction to global health, we said basically we are looking at uh, global health problems or health problems that transcend borders. Okay, this is to say that we are looking at health problems that cross borders. Okay, so we want to look at what countries are suffering from what. Okay, that's the basis. We want to look at which countries are problems. That is our interest in this presentation. So we want to say um, the countries and the health problems that they actually face. So what health problems do we have in developing countries? What health problems do we have in developed countries? And how best can we use the knowledge of these understanding this burden in terms of diseases, in terms of risk factors, and in terms of injuries to be able to plan on how to deal with these problems. So the first issue always is that first understand the problem before you deal with it. So we want to understand what's the burden of diseases, what is the global burden of disease. So when we talk about this, we'll look at, like I said, what health problems are facing which countries, and then we look at what metrics do we use, okay, in determining the burden of disease. Then the last point, which I've just said, what is happening where? That is our interest. We need to know what is happening where. So let's move. Make sure that we have our presentation in slideshow. Okay, so the global burden of disease is about a comprehensive and a systematic assessment of the health impacts of diseases, injuries, and risk factors across countries and regions. Okay, so we are not only interested in understanding how many people are dying from what diseases, or how many people are having a particular diseases. It is more than that. Okay, it is more than that. So it moves away from the quantitative part, but it also has a qualitative part. That's why we are saying that it moves beyond simply counting the number of people who are dying, that is mortality, or the number of people who have particular condition, that is morbidity. So it is much more beyond that. Okay. So why are we interested in this? When we know the burden of disease, or when we know which country is suffering from what conditions, we can be able to compare and say the other country is healthier than the other. That's one. Two, it allows us to know that in the last 10 years, Kenya has improved in health compared to South Sudan. Or the indicators of overall health in South Sudan are declining compared to a neighboring country. So we are able to know the trends, what is happening over the last 15 years, the last 20 years, what is happening. We are able to know that using the data that we get from the global burden of disease. Okay, so where does this data come from? How are the computations made? There is a collaboration between researchers, policymakers, and stakeholders around the world come together and look at this complex data and be able to compute the different metrics that we shall look at about the burden of disease. Okay, so this work is spearheaded, coordinated by the Institute of Health Metrics and Evaluation at the University of Washington. So this work is also supported by WHO. So WHO has huge support on compiling data on global burden of disease. So if we know what diseases, which countries are affected by which diseases, it means that we can have efforts to address these diseases. So it helps us in decision making and setting priorities. Okay, it's to know which health problem do we have to address first, using global actors or even at regional or national actors. So, for example, countries in countries in developing nations, okay, or in the or what you call the global south, where should they put the emphasis? Okay, uh, data helps them to know the areas where they can put emphasis. So it helps in priority setting. It's also very good in providing us with knowledge about what is happening and how we can actually measure health. Measurement of health is one of the complex issues that we have. Okay? We often use morbidity and mortality indices for measuring health. Like what are the other innovations that we can have in measuring health? Okay, so the global burden of disease is one of the strategies that helps in measuring health around the world. And we said it is um, systematic and it is also very comprehensive because it covers a number of countries. So 204 countries contribute data about the global burden of disease. Okay, and the number of diseases covered has been increasing over the years. The history of the global burden of disease started around 1993. So over the years, the number of diseases that are being covered has been increasing. Of course, they did not start with the 369 diseases that are being recorded. Now they started with fewer, but now there is also incorporation of injuries and then risk factors. And then there is also issues to do with comparison with the with age, okay, and then comparison with sex, okay. These are things which were not initially there in the global burden of disease. So every year, estimates are made and published, okay, such that people can actually understand where the world is going in terms of health outcomes or health or disease burden. Okay, so this data that is used to understand the disease burden globally comes from national vital registration systems, comes from censuses, comes from surveys, registries, administration records, and also scientific literature. So this is to say that the data used in compiling the global burden of disease comes from a variety of sources around the globe. Okay, so of course, this data has its own limitation in terms of the quality, in terms of being insufficient, in terms of issues to do with biases. Generally, in the real world, the way this data is being collected may have issues. But of course, using the appropriate statistical methods and models, um, it is easy to integrate and analyze this data while undertaking or while accounting for uncertainty and variability. Okay, so statistically, there are ways in which errors or biases, irregularities with data can be accounted for, and then you have data that is actually of good quality that can be used to make appropriate decisions. Okay, so the global burden of disease uses one metric which we shall actually focus on, which is it uses the hierarchy of causes and then a common metric called the daily, disability adjusted life years, daily, okay, or dailies in plural. So this daily is what is commonly used in comparing the disease problems across different countries, different regions, or different continents. So we are going to look at what it is. Disability adjusted life years is a composite measure. Okay, when I say a composite measure, it means that it incorporates a number of elements like mortality. It has the mortality element and then the morbidity element. Okay, so it does not only look at the number of deaths and does not look at only the number of people having a disability. It looks at both, so it is a composite. So it has quantitative and also a qualitative element, as we shall see in our discussion of what it is actually in details. So how do we calculate this? So it is basically a figure that tells us the overall burden of the disease in a particular population. And we said it is a composite because it has mortality and morbidity. So it can be calculated by adding the years of life lost due to premature death plus the years lived with disability. Okay, you add two things: the years lived with disability and then the years lost due to premature death. Okay, so that's basically the formula for calculating disability adjusted life years. So we look at what years lived with disability mean. What does it mean? So you get a chronic illness. This chronic illness will affect your quality of life. Okay. So if, for example, you get an accident and then you get a fracture, okay, you get a fracture. If you're working, you may not be able to work again. So it means you're going to stay home with that fracture, and you not be able to do certain activities that you used to do. For example, taking yourself to the shower, going to work, doing activities of daily living on your own. So when you have this disability, which is a fracture, it means that it affects your overall health. Okay, so you're going to live with disability for some time until it is actually the fracture is healed and you can now continue with your own normal activities. Or sometimes the fracture can actually heal, but you still have some other complications that still uh, can affect your life. Okay, so how many years are you going to stay with that disability? Okay, so that is about the years lived with disability. Okay, so we can look at it at a population level or even at a person or individual level. Okay, we can look at it at a population level or at an individual level. So it gives us an aggregate of the different conditions that can affect populations, and then we are able to know how the burden of a particular condition. Okay, so you can have a disease that is not really fatal, or fatal. That means that it does not kill someone, but it affects their life. Okay, uh, in terms of productivity, in terms of overall quality of life, we cannot enjoy their life as if they were actually uh, healthy. So let's look at how it is calculated. Okay, here. So at a population level, you get the number of people who have that particular disability. And then you multiply it with uh, with the weight and then the duration. Okay, you multiply it with the weight factor and then the duration. So let's basically explain this. So if you're going to use our example for the fracture, okay, the fracture will take sometimes months to heal. Okay, so you'll be with that fracture for, let us say, 3 months before it heals, before you come back to normal. And then what about the weight factor? Diseases vary in terms of severity. Okay, how different people experience severity of particular condition actually differs. Okay, so we have a scale that ranges from 0.0 to 1. So these diseases are weight. Okay, these conditions are weight. A score of 0.0 means you are healthy. A score of 1.0 means death. There is no life. Okay. Now, so that means that for every condition there is a weight factor. Okay. So um, the years lived with disability equals to 1 if it is at population level, the number of incident cases, and then the disability weight, which we have explained there, and then the average duration of disability. So, for example, if you are looking at fractures that have happened because of road traffic accidents, we look at how many people are having these fractures. Okay, that is the number of incident cases. Then we look at the average, on average, how long does it take for the fracture to heal? Okay, and this is in years, and then the disability weight. Okay, and then when we multiply that, the duration, the incident cases, and the disability weight, we get the years lived with disability. So the importance of years lived with disability is that it allows us to compare the impact of different diseases. So, for example, um, you can have a figure for different diseases, different figures for different diseases, and then you'll be able to know that, okay, people who suffer from these conditions are there is a lot of burden that they actually carry, okay, compared to this disease or the other disease. So it allows you to know the priority areas where you can implement interventions. But it also allows us to monitor the trends over time. So you can have years lived with disability for a particular condition for the last 5 years, and then you're able to know whether you're improving or you're actually declining. Okay, and then um, the years of life loss. Okay, years of life lost. Remember, we said that daily, which is uh, disability adjusted life years, equals to years of life lost plus years lived with disability. So how do you calculate years, uh, years of life lost? So here you calculate at population level, you have the number of deaths from a particular cause. Let us say ischemic disease, that is. So in a particular region, let us say Central Equatorial, how many people have died from ischemic disease? And then multiply that number by the standard life expectancy the at the age of death. So by the time these people died, what was the standard life expectancy? So if the life expectancy, let us say in South Sudan is 64, okay, is 64, and then you have someone, or you have someone who has died of ischemic disease, ischemic heart disease, at a and that person was about 50. Okay, the person has died at 50. So for you to capture the years of life lost means you get the life expectancy, which is basically 64 minus the age at death, which is 50. Okay, and then you get 14 years of life lost. Okay, so those are the two. This one here is the mortality indices, that is years of life lost is the mortality one, and then the other one, years lived with disability, is a morbidity indices. So we can use daily, of course, to understand the health problems that people are facing, and then be able to prioritize which health problem we need to address immediately. And then also, if we institute public health interventions, we can be able to know over time, see the impact of the public health intervention. So we can use Delhi as one of the indicators. See, at the time when the intervention was starting, Delhi was like this, and then at the end, when the intervention is stopping, you also say the Delhi is this, and then therefore you can say that the public health intervention has been successful or has been impactful. So therefore there is value for money, okay, and therefore you can allocate more resources to bring to cause change, okay, to cause to institute further into the project. Okay, so we also move further to the next slide. So we already said the different sources where you get the data that can be used for estimating global burden of disease. It's the same, they are the same sources that you can use for calculation of deaths. Okay, one thing that I did not explain is about how do you interpret daily, which is here. So one daily represents 1 year, or represents the loss of 1 year of full health. So it means if you have a higher value of daily, it means you have a higher disease burden. So you don't want to have a daily which is higher. Okay, so if you have a daily of 2, it means that you have a loss of 2 years of full health. That's something that you really need to know about interpreting dailies. So the limitations of dailies, we said earlier on, and I want you not to forget this, that daily is like the gold standard for comparing uh, health status of different countries, okay? But it also has its own limitation. One is that there is subjectivity in weighing. Remember, we said that we have that scale of 0 to 1. Okay, so if you're going to ask an individual to rate how a particular condition has affected their life, then they will give you a figure. Of course, this figure is subjective. Okay, so there is that element of subjectivity in weighing. And then also the way people interpret different illnesses is also different. So we have cultural biases. Some regions do not have sufficient data to be able to give you very good information about delis. Okay, so the calculation of delis may have errors because of insufficient or unreliable data. Okay, and then the other thing is that the delis are limited in terms of only focusing on health outcomes, yet there are other very important factors that contribute to health, and these are the social and economic determinants of health. And then it overemphasizes overemphasis on delis reduces or creates a it creates an impression where we neglect focusing on other aspects that are very important on well-being. For example, even the social and economic determinants of health. So it's only, you remember, health is almost a product uh, uh, of what we call the social determinants of health. Okay, access to water, access to education, access to quality housing, all these things contribute to health. But now, if you only look at morbidity and mortality, you forget these other very important aspects that contribute to well-being. That's the last point. So I'm going to go through key statistics on the global burden of disease. What are the key things that might interest you in the global burden of disease report of 2019? Okay, so globally, the leading cause of disease, the leading causes of death in 2019 included ischemic disease, stroke, chronic obstructive pulmonary disease, lower respiratory infections, and then neonatal conditions. In the same year, the leading causes of delis include the things which basically the disabilities that people have, okay, that contribute to lower quality of life, lower back pain, headache disorders, depressive disorders, iron deficiency anemia, neonatal conditions. And then we go to the leading risk factors globally by 2019: high blood pressure, tobacco smoking, high blood sugar, high body mass index, and then polluted air. Okay, and I think we are doing very bad, especially for those of you who stay in Juba, in terms of pollution. There are areas in Juba where, like, okay, the dust is almost what you breathe in and out. So the other issues that, okay, we have talked about the leading risk factors, and now we look at the leading risk factors for death. In 2019, high blood pressure, tobacco, these are the things that I've actually just mentioned. And in the leading risk factors for delis, some of them are the same we have actually looked at. Okay, so globally, you're able to really recognize that the things that cause diseases or that cause death are high blood pressure, tobacco, high sugar levels, and then obesity issues. Okay, and then high fasting plasma glucose. These are basically the same things that are always recurring. So earlier on, I said that with the global burden of disease, you can be able to know the trends, what is happening. So in this slide, we can see that the leading cause of uh, death has been changing over years. Okay, so in the early 1990s, lower respiratory tract infections were the leading cause of death. But now we have ischemic heart disease being the leader. Okay, so we can see that uh, uh, over the years there are changes in terms of what conditions are causing many deaths. And then across countries, what are the key things that we can note? Okay, so low income countries have higher disease burden compared to high income countries. This is basically what we have just explained, that social determinants of health, access to education, access to healthcare, malnutrition, and then poor sanitation, all these contribute to a number of diseases that we are actually facing. Okay, so low income countries are having a higher burden of disease compared to uh, uh, those that stay in high income countries. Okay, even when uh, the global population is actually less in comparison to the global population. Okay, so this is to say that you are the one who is actually poor. You are poor, but most diseases are affecting you. Yet most diseases are affecting you, yet you're actually the ones who are actually fewer in number. You get the problem. So you see you have one problem after the other, one problem after the other. You are poor and you're the one who has more diseases. And yet in comparison to other countries, uh, the deaths are more in, and a lot of, you see, it is very important that our countries actually get richer. Okay, if they get richer, then you will not have issues of malnutrition, issues of access to healthcare, all environmental hazards. Some of the things are reduced when you become richer as countries. Okay, so that's the point there. Okay, so the leading causes of death or the leading diseases in low income countries, uh, lower respiratory infections, diarrheal conditions, malaria, tuberculosis, and HIV. You should be knowing this. Okay, for example, these are the leading conditions even in South Sudan. Okay, whereas high income countries have conditions such as ischemic heart disease, uh, stroke, Alzheimer's, and the dementia, lung cancer, and chronic pulmonary disease. Okay, these are basically diseases that are associated with the aging and also lifestyle. Whereas for us, we are having diseases that are associated with basically poverty. Okay, poverty, because of poverty, you don't have access to clean water. Because of poverty, we are having some of these communicable diseases being rampant. Okay, HIV, tuberculosis, malaria. Okay, we actually generally call them diseases of poverty. Okay, so that's what we are having. And then the other thing that we also have is that even after having this, basically you can see that the top causes of disease in low-income countries are infectious uh, diseases. Okay, so on top of having infectious diseases as the leading causes of death or disease burden, we also have non-communicable disease increasing. So we are basically also having another problem that is boiling. So we are also adopting diseases of the rich, high blood pressure, ischemic disease, coronary disease, and things like that. So they are also on increase. And this is where you are having the concept of double burden of disease. We are having infectious disease high, but again, there's also an increase in non-communicable diseases. But if you look at the trajectory or the trends, you realize that across the globe, there's some significant improvement in mortality. Okay, so the number of children dying has gone down. Average life expectancy is also increasing. So you see that over the years there is improvement. Collaborations, research, innovations, partnerships, all the things can be attributed to, can actually the ones that can have contributed to the significant progress that has been made in improving global health outcomes. Okay, but still the other thing that you can really see is that yes, there is you see there is improvement, but there are also countries which are behind. That's not something that we really need to forget. Okay, so if we are having improvement at a global level, that does not mean that the improvement has been this equally distributed. Okay, so we have other countries that are also having very poor health indicators, and therefore we have inequalities or what you can term as disparities. Okay, and then we also see that the COVID-19 pandemic also had a lot of impact on health systems worldwide. So in some places there have been disruption in terms of provision of essential health services. Okay, and then also those who are originally vulnerable are also now more vulnerable. Okay, so that marks the end of this presentation. It's time for questions.